Good afternoon. Welcome to the local Glascock County Emergency Operations Center COVID-19 briefing for today, May 4th. Today's press briefing is being offered to you via our media partners by Zoom as well as Facebook Live. This is an attempt to encourage social distancing and improve our communication and reach, but it's also an opportunity to protect our media partners, keep them safe during the COVID-19 surge. For all media who are joining us via Zoom, we ask that obviously you're going to be muted as you enter the meeting. You'll be given the opportunity to ask questions after all the speakers have completed speaking. If you are on a computer, we ask that you raise your hand, that's kind of in air quotes, or put the question in the chat box. We have facilitators and moderators here that can read your questions for you. Dial-in participants, you'll need to hit *9 to raise your hand, and you'll be given the opportunity to ask questions as well. We will try and address all questions. However, if your question does not get asked, it will be forwarded to the appropriate question, or to the appropriate person, and will be answered to you. The answer will be sent back to you with the best answer possible as soon as we can make arrangements for that. Today, being Monday, we always try and bring in our medical partners and medical directors so that we can address the growing changes and trends that we see happening over the weekend. And today, we're seeing some dangerous trends that we want to address with regard to long-term care facilities, a spike and increase in deaths in Glascock County as related to the COVID-19 virus. And so we'll jump right in this afternoon with my introduction as usual to the Incident Commander and Director of Public Health, Dr. Nafissa Cisse-Egbuonye.
Good afternoon, everyone. As of Monday at 12:30 p.m., there's a total of 1,546 reported cases in Glascock County. We have had 3 additional deaths since Sunday, making our total deaths 18. We have a total of 75 cases hospitalized since COVID-19 here in Glascock County, and we have 519 recovered. We have 2 long-term care outbreaks here, Harmony House and Friendship Village. So we will continue to focus on long-term facilities and working with facilities with positive residents. We'll also continue to work with businesses to ensure employee safety and review and address any issues in regards to implementing mitigation protocols. I urge all Glascock County residents to continue to stay at home. Social gatherings can only be done with people who live together in the same household, and please continue to stay at home and practice social distancing. Leave your house again only for essential services, and continue to wash your hands frequently, covering your mouth and sneeze with your upper arm or tissue. Continue to clean and disinfect frequently touched objects and surfaces. To all the frontline staff saving lives every day, we thank you. Thank you for all that you do. We value every single effort, again, that you make to save every life. I want to talk about something that I've seen and believe to be important for me to mention publicly. And so this is about graduation. I've seen on social media some of the communication in the last couple of days regarding the graduation announcement for Waterloo School District. I want to personally thank Waterloo Superintendent Dr. Jane Lindeman for reaching out to Public Health. Dr. Lindeman called me with great enthusiasm and care for her seniors. It warmed my heart to just hear her voice in regards to some of the ideas that she and her administrators were thinking in regards to the seniors. So I gave her the recommendation for a virtual graduation, and I've just seen some of the negative feedback that Waterloo School District is taking in regards to that recommendation. It is a recommendation that I stand firm behind because this is what is important right now to protect our residents and the seniors and their families for COVID-19. This is also something that we're seeing across the state and nation that school districts are doing. So my message is to the seniors and families. Please do know that your school administrators care for you. They did the right thing in consulting with public health. We celebrate you all. We acknowledge your hard work, and we so desperately wish COVID-19 was not present in our community. Families, support your seniors by promoting healthy communication and understanding of the situation. This is not the time for us to put blame on schools, people, or politics. This is the time to fight against the continued spread of COVID-19. This is the time to celebrate your seniors safe at home. Throw them the biggest graduation home-based party ever. And for me, a senior that graduates during COVID-19 is one that is resilient and perseverant. You will have stories for your kids, your grandkids, and your great-grandkids of the experiences you overcame to graduate during COVID-19 era. We are very, very proud of you and can't wait to see what you will accomplish in your lifetime. So thank you very much for understanding. I know this is very difficult, but by no means does it mean that we do not want to celebrate you. In fact, we want to celebrate you even more so because of this situation. Community, let's continue to fight COVID-19 together. Please don't give up. Please don't give up hope. You are safe when you stay at home, and we will overcome this pandemic together. Thank you.
Before I introduce our next speaker, I just have a couple of observations very quickly. Number one of the things that we had the opportunity to do on Friday was visit with corporate Tyson representatives here at the Waterloo plant and see the amount of massive improvements that they are demonstrating and the amount of efforts that they are putting into that plant to make it safe and render it safe for their employees. We look forward to continuing that dialogue. They have not indicated to us that they want to open yet, even though there is this federal request out by President Trump, and that was also encouraging to us. They did indicate to us that they want us at the table. They want partnership here with community and community leaders, and so that was an energizing and encouraging first step forward to get that plant reopened. Item number two is, as you kind of continue to pay attention to the numbers that we are seeing as they change, you're seeing our death rates increase. You're seeing and you're hearing about long-term care facilities starting to experience outbreaks. I think we have 2 in outbreak status now, and we're monitoring 5 total facilities. Those kinds of things make me concerned because we are seeing our most vulnerable population now being afflicted and affected by the COVID-19 virus. I, too, echo Dr. Nafissa's sentiments when she says to those frontline workers, thank you. Thank you for their efforts. Thank you for their energy. Thank you for their willingness to go in and fight that battle firsthand every single day, knowing that they're going to work in an environment where COVID-19 is there, it is present, it is a very real danger. These are challenging times, so much so that last week I spent a lot of our time at the Emergency Operations Center talking about staffing. We have facilities with over 100 patients, and say a quarter of them could be COVID positive. How do we maintain staffing on a facility like that when staff starts getting sick? Those kinds of things are greatly and deeply concerning. And so through the Emergency Operations Center, working cooperatively with the State Emergency Operations Center, working with the Iowa National Guard and friends that we have developed and people that I used to work with there through the Joint Operations Center there, we are continuing to work issues to try and support the impacts of the requirements for staffing. So those are all critical pieces that the Operations Center here in Blackhawk County is working to not just try and make arrangements for PPE and try and make arrangements for masks and gloves and things of that nature, but also staffing and more critical pieces as well. So those are things that are critical and things that are on our horizon right now that we're quickly and immediately digesting. I too want to champion those folks that are in the fight. Know that we are with you. Know that we are trying to resource every available person, every available piece of equipment, and every available option and opportunity to make it worth your fight and make sure that you are well prepared, well supported, and well equipped for the fight that you are providing for Blackhawk County right now. With that, it's my pleasure to introduce to you Dr. Daniel Glascock, the UnityPoint-Allen Hospital Chief Medical Officer.
Thank you, and good afternoon. I appreciate the opportunity to speak with you today. And first, I wanted to spread a little bit of joy. I think that we need to acknowledge some of the great work that is being done by a lot of the people that we work with. And I want to recognize Nurses Week. Nurses Week is coming up May 6th through May 13th. And I really want to express my sincere gratitude to all the nurses, the RNs, LPNs, CMAs, everybody, our patient care techs, that are really working hard to try to shoulder the burden of this pandemic, especially those that are being asked to redeploy in areas of need. So I just want to recognize them as we get ready to celebrate Nurses Week. And if you haven't already, I would ask you to kindly keep them in your thoughts and thank them for the fine work that they're doing. I'm very proud to work alongside some really exceptional individuals. I have a few updates to share and keep you informed on what we are doing to work against the pandemic and what we are trying to do to keep our patients safe. So first of all, today we have opened up our follow-up clinic for patients who have had positive tests for COVID-19. Last week I talked a little bit about this silent hypoxia that some patients develop days after being tested. And so I want to talk a little bit about that. The purpose of this clinic is to maintain contact with our patients to assess symptoms and determine if a higher level of care is needed. In particular, we can check O2 saturation levels. We can take a listen to their lungs. We can check their temperature and assess for deterioration of their illness prior to needing emergent evaluation in the emergency department. This is intended for patients who have already had a positive test, either through the clinic, through the emergency department, or after being admitted to the hospital or having other testing elsewhere in the community. The clinic will be located at the tent that we put up outside Allen Hospital Emergency Department. So we're kind of repurposing that. We're not using that tent as a testing facility anymore. That's now our follow-up, so we can monitor these patients that need to be evaluated ongoing, because we know that the symptoms don't necessarily get better when you're first diagnosed or get that phone call saying that you had a positive test. So we'll be able to monitor blood oxygen levels and assess for whether or not further care is needed. When it makes sense for patients to not come see us in person, so if they get the call at home stating that they're positive for COVID-19 testing, we also have a secure text messaging system that's set up to help follow them over time to offer further guidance virtually as they go through this process. Ultimately, we want to get these patients connected or reconnected with primary care providers, and those providers will continue to schedule more virtual and telephonic visits as needed. I also wanted to update the community on some potentially good news that we've had over the weekend. And you may have heard about this, but there's been an emergency approval for a medication called remdesivir as a treatment for patients that are severely ill. They have seen positive results in clinical trials and have now made this drug available for hospitals. So Gilead is the company that produced this and is giving their entire stockpile of this medication to the federal government. But we aren't sure how that is going to be divided across the country. But they are stepping up production, and hopefully by the end of this month, they'll have something like 140,000 courses of that medication for treatment. And they will be disseminating that. This federal government will disseminate that to the areas of greatest need. But we haven't heard anything about whether or not that would include Blackhawk County or if that would include Iowa at all. So we'll have to keep our ears open for that. I also want to share that elective surgeries and procedures are scheduled to resume on April 24th. The governor issued a proclamation stating that as we are able to start resuming elective surgical procedures. Now we're taking a very careful approach to this, as is every organization. And there are certain criteria and guidelines that we have to meet before we can resume doing surgical procedures. So we won't do that until May 11th, and then Marshalltown will resume surgical procedures the following week. But it's really been more than 6 weeks since we suspended those procedures, and a lot of planning has taken place to do this properly and safely. It will be a very measured approach as we gradually bring back these services and currently plan to be back to operating at full capacity sometime later this summer. Of course, we have to keep a very close eye on how the virus continues to grow and spread in our community, and we also have to keep a close eye on our supplies and our protective equipment, as well as each hospital has to be able to continue to screen for these patients as time goes on. There's also some requirements in the governor's proclamation that you have to have a certain number of beds that are dedicated to COVID patients and a certain number of IV or ICU beds dedicated to these patients. So all that is based on our current levels, and that can certainly change over time. So beginning this week, we're also asking that everyone who comes into our facilities wears a mask. So I think universal mask for everybody is important. And another thing that we're doing at Allen Hospital is that every patient that is admitted, regardless of what their symptoms are, is going to be screened for COVID-19. So that's just another mechanism I think that we're using to try to continue to see how much of it is out there in the community, because as we have talked about many times before, there's a fair amount of people that are asymptomatic that are carrying this virus, and we obviously want to catch them as we are able to. We are encouraged that some of our internal modeling suggests that maybe we're hitting a plateau, but we certainly can't rest on that. We know that admissions and our average hospital volume have remained fairly static over the past several weeks, but that's only due to everyone continuing to do the things that we are supposed to be doing to try to flatten the curve. So that's the staying at home and the wearing the masks and washing your hands and social distancing. We certainly encourage everybody to continue to do that so that we can continue to try to flatten the curve on this pandemic. As always, we want to thank everyone in our community for all their support. This has been a very intense time, and it continues to be a long journey for all of us, but we can't do this without everybody's help. So thank you very much.
Next, we're going to refit here for just a minute, and we're going to invite Dr. Matthew Sojka, the Chief Medical Officer for MercyOne Covenant, to join us via Zoom.
So thank you for your time today. I decided to socially distance and stay here in my office and work with the staff here on the local site, but still want to be part of the communication. Just like UnityPoint, MercyOne is working on their recovery. We're still deciding what date we are going to use for starting our surgeries. We have a meeting tomorrow with many of our surgeons to have that discussion and to get the processes in place, but it will be soon. And we are excited about trying to get back to some semblance of normal, the new normal as we see it going forward. Our fever clinic, Fury Clinic, continues to operate. We've seen a decline in numbers as one, the Tyson staff have already been tested, and two, the Test Iowa is available. Several of our staff, along with other local healthcare providers, have been providing staff to the Test Iowa. And if you think you need to be tested or want to be tested, please consider that as an option. Information's on site at the Test Iowa site. We have been continuing working with our surge plan, but we have seen somewhat of a flattening of our inpatients at this time. So at the moment, we're doing well. So is this going to be the continuance of the numbers that we see despite the nursing homes and facilities seeing an increase in numbers? Are we doing better at keeping those patients away from each other, socially distancing? Are we doing better with staff masking in those facilities, washing hands, using gloves when needed. So I'm encouraged that we've not seen a huge number of inpatients from these facilities, but I'm always nervous that just one episode, one facility would be the tsunami that really takes us over the top. Also, I do agree that we are working with our staff. I really appreciate what they do, the nurses, the aides, the cleaning staff, the physicians that are on the front lines. They really are doing a great job. This has just been a long marathon for them. Most times when we get into a crisis, it's here for a few days, maybe a week. This has been 6 weeks, and we don't know when this is going to end. Is this our new normal? And please, again, as others have said, socially distance. Mask if you can when in public. If you had COVID-19 and were a carrier, if you wear a mask, you have less than a 5% chance of spreading it to somebody else. But if you are carrying and they're wearing a mask, they have up to a 70% chance of getting the virus from you. So masking is the most important way of us stopping the spread. And just in the news today, yesterday, Costco and Menards are requiring masking of all people coming into their facilities. And I want to thank those companies for doing that. That is what we need to do to protect the community, to decrease the spread so it doesn't affect more of our individuals. Thank you.
Thank you, Dr. Saco. All right. Our final conclusionary speaker today from People's Community Health Clinic here in Waterloo, the co-director, Dr. Sharon Duclos.
Hello, everybody. So, kind of as we said, it looks like things are plateauing, which is good, but we still have a long ways to go. So we're not out of the woods yet, but hopefully headed in the right direction. And how long this goes, we don't know. But again, as we go through this process, we all have to make sacrifices. And I realize that that is hard. I think I would like to kind of address the high school graduates again, because it is a big deal to graduate. It's huge. That's one of your very first milestones to get through that and to start the next phase of your life. And you've worked this hard for 18 years to get to that point. And of course, with any success, you want to celebrate. And you want to celebrate like we traditionally celebrate with a lot of people. We all get that from us older people who have celebrated in the past. We get that feeling. And I am so sorry that this was the year for you to graduate and you've had to deal with this. And that's tough. It is hard. And so you're going to go through a grieving process. The families are going to go through a grieving process of realizing we can't celebrate like we want to. We can't go out in a room full of people and shout and hoop and holler about the success of our loved ones. So you'll go through the grieving process. And it makes you sad, you'll cry, you'll feel angry. Sometimes you even feel that disbelief, like I can't believe this is happening. This is my senior year. All those emotions are very common, they're very normal. And it's important to talk about them. It's important to talk about them with your friends and family as far as how you're feeling. But then it's also important to think, if we can't celebrate traditionally, how can we celebrate so we can really shout from the mountaintops the success of people who have graduated? And so that's probably what I would task you to really get creative as far as how you celebrate. I can tell you from my patients who are struggling with the infection, and with the families who are struggling with having a loved one in the hospital with infections. if they were standing next to you, they would be shouting from the mountaintops to say, do not get together. Do not get together in a group. This is serious. And it can be devastating for some people. The good news is most of us do just fine. That's the good news. The bad news is some of us don't. And it's not like we can walk around and say, okay, that person is not going to do well and that person's not going to do well. But everybody else, go ahead and get in that big room. You're going to be okay. Wish we could do that, but we can't. And so it is a heavy feeling, and it's a burden. Is God forbid that you finally, that you decide we are going to celebrate, and I am going to have a house full of people. If somebody left there and got sick related to that house full of people as far as the celebration, it is a big burden to bear. So just remember that. Is really, really work on just trying to celebrate in a different way, and not the traditional way that we've celebrated. Next is definitely hats off to the first responders, hats off to the hospitals and to the nurses, hats off to the people who work in long-term care facilities. Talk about another hard job is working in a long-term care facility. Again, that little pit in your stomach, if you're working in one of the organizations where you're starting to see the spread, it is a helpless feeling to see elderly people get really sick from this. And it's not an illness when you get sick that you get over in a few days. A lot of times this takes weeks and weeks, and you just kind of get a slow decline. So for the people that work in those long-term care facilities, fight hard. Find that compassion and empathy like you do for your patients, because sometimes that's about all we can give them. And that compassion and empathy goes a long way. People in long-term care facilities are isolated. They don't have visitors, and this has been going on for months and will go on for months. Sometimes the requests that we get are for like iPads, some way to communicate with family. Because not everybody has an iPad and has a way that they can FaceTime. So if anybody wants a project out there, that's a wonderful project to help a lot of long-term care facilities to be able to communicate with their loved ones more frequently and doing that FaceTime. I think that would really, really help their mental health to be able to do that. The last thing I just want to share is, again, the social distancing. As we open up and things start to happen more, we even have to be more diligent about the social distancing, about the hand washing, wearing the mask in public. And so there's a couple of things I do want to address, because you see this all the time. So remember, wearing the mask in public, it's not helping you not get something. You're actually trying to help somebody else not get your germs. You're trying to catch them in your mask. So one of the things that you see a lot is you understand, a lot of times people don't understand the right way to put a mask on and take a mask off. And so it's really important when you put a mask on and take a mask off that you're holding it on the sides as you put it on, and you're not touching your mask on the inside or the outside. Because what happens, as you breathe, your germs are going in that mask. Sometimes you're sucking in things from the outside that are on the outside of that mask. The mask becomes dirty. You can't see it, and that's what makes it so hard. You can't see the dirt, but it's there. So this is what I see when I go to Walmart. People have their mask on. They take it like this. They'll put it up here. They'll put it down here. They'll go under here and start to itch. They take it off. I've seen them do this. They'll put it in their hands. And so realize all this touching, I've just got it all over my hands, and now I'm going for the fruit, or now I'm going for the can, or now I'm touching something else. So it's really important when you wear your mask, hold it on the side, don't touch the center of it. Take it off that way. And with the cloth masks, you have to wash them. Wash them every day. That's very important too. The next thing I want to address is gloves. That's the other thing I see when people go out into public. I see several people wearing their gloves. They'll put their gloves on and they'll go in. And I think it's that false sense of security that these gloves are going to help protect me so I don't get this virus. So once you put your hands in your gloves and you start to touch things, your gloves are now dirty. So do the little test at home. Put the flour on the counter, put your gloves on, put your hands in the flour and start touching other things. You will see, you will spread it just as bad as if it were your hands yourself. Okay? Gloves aren't going to protect you out there. And my favorite thing is again, people have the gloves on, and what do I see them do? Their gloves are on. They put their hands through their hair. They rub their face. They put their hands in their purse. They pull out their billfold. Your gloves are dirty, just as like your hands are dirty. And so you're not preventing the spread of anything there, okay? So proper use of gloves is when I do a procedure, I go into the room. When I go into the room, I put my gloves on. I do my procedure. My hands are dirty. I'm doing it all right here. And then once I'm done, I take the gloves off and I wash my hands, and then I leave the room. That's how gloves are supposed to be worn. They're not just, I'm going to put them on and I'm going to head on out and I'm going to do my shopping. I'm going to fill up with gas. You know, everything you're touching, your gloves get dirty. So I just don't want people to have that false sense of security. I've got my gloves on and I'm protecting myself. In reality, you're not. The most important thing is the hand washing. You go out, you do your thing, you wash your hands. You come home, you wash your hands. You wash the countertops. That's a way that you can truly help yourself, not by putting the gloves on and start touching things, is because as you touch yourself, again, your gloves are dirty. So those are the two big things that I've noticed out in public that I thought would just be a very good idea for us to go over again so people can help themselves try to protect themselves. So the 6-foot rule for sure. Somebody's wearing their mask, they're sneezing or something, things can't fly as far, and that's why we're asking you to wear your mask. I totally agree. When you go into any establishment at this point, we should be wearing our mask. Out in public, any establishment, wear that mask to help protect the next person. So otherwise, that's my educational little seminar today. Everybody out there, please keep fighting. Please keep working on that social distancing. Those in the medical profession, hats off to you. You're doing a great job, and keep it up.
I want to mention to the community to go to blackhawkcovid19.com. Our epidemiology team has worked really hard during this weekend to release additional data for the community. We have data that is available in regards to race, ethnicity, gender, age, hospitalization. All the data that I communicate now is currently available on blackhawkcountycovid19.com, and if you click on the data source, that is there. Thank you.
All right, this concludes our prepared remarks for the day, pending your questions. Outstanding. If there are no questions, I will preface Thursdays. We do have one?
Yep, we do. Go ahead, Taylor, you're unmuted. Oh, oops. You'll have to turn your sound up.
Talking about, we use the term we're plateauing. Is that just another way of saying that we might be seeing the end of the surge?
So when it comes to plateauing, we really don't know how long that could potentially last. And I think that the important point with the plateauing is that we are only plateauing because of all the things that we're doing, all the social distancing. If we had not been doing this, we would still be going up. We would still be, exponentially growing. So, the plateau could last weeks. It could last months. We simply don't know the answer to that question, and it depends a lot about what we do going forward. So if we open up the state, then I think that puts us at risk. If we are spending more time getting together and congregating, going back to church, those types of things, then we are putting people in harm's way again by simply having people all in close contact, and many of those people may have coronavirus and not even know it. So, the idea of plateauing is simply we're noticing day over day and week over week that, between Allen Hospital and Marshalltown, we've had around 35 or so patients admitted at any one time, and it's been fairly steady. So that's what we mean by a plateau. But we know that can change in a heartbeat. All it takes is one infection in a nursing home. That's one of our highest risk populations of patients. So when that happens, and we have seen that happen, we start to see the spikes. Up in Waverly is a good example where they had an outbreak in a nursing home there, and they've had a lot of new patients that are diagnosed with COVID-19, and consequently a lot more hospital admissions, and we've seen spike in the number of deaths up there. So we need to continue to do all the things that we have been doing by protecting ourselves and protecting the community by staying at home if you don't need to go out.
I'll add on to the same comments that plateau, we don't know if this is the new normal, that we're going to be sitting all summer with these type of numbers. Or are we going to see an increase of 50%, 100% above this? Or is it going to be slightly lower? We don't know, but everyone protecting themselves and protecting everyone else is going to be vital for us to not surge further.
Thank you, Dr. Sejka. Any other questions?
Maybe one more. I think Taylor Vessel has another question. Go ahead, Taylor.
Yeah, a couple, I'll just do a two-part question with Nafissa. In regards to that new data that you're releasing for age, ethnicity, sex, real general, what do you hope that provides to the communities within Blackhawk County?
What the data provides?
Yeah, because we do have a higher population compared to the rest of the state for folks of color and minorities. So I was just kind of hoping, I know we've been asking for that for several weeks. What do you hope it provides to the community?
The most important thing is transparency. I want the community to always know that if we have data that is available and we can publish, it is there. So those are talks that have occurred nationally, statewide, and even at the county level. So we wanted to make sure that we had, we were able to look at the data, ensure that there is no HIPAA violation, and this is something that we could publish. And so now that it's readily available for the community, it's for us as a health department, it's transparency. So people do see how COVID-19 is overall affecting all demographics. And so the information is available, and we will continue to update the information as we continue to get our cases, but it is available now.
I know last week we had some discrepancy between the numbers between the state and what the county had reported. We've still seen some people kind of reach in. It seems like after that was corrected, it seems like there's still a bit of a, the state's numbers aren't lining up time-wise with what we're seeing. We know they're about 24 hours behind from the state. An example that a viewer sent in to us was May 2nd, 10 a.m., the county was reporting 1,507 cases, but the state, as of May 2nd at 10 a.m., only reported 1,306 cases. And I was curious what the update was on kind of how we're working with the state to ensure that everything is being tracked accurately.
Oh, we are working with the state to ensure that everything is being tracked accurately. Again, the reason why this was changed is because we, at the local level here in Blackhawk County, we wanted to make sure that our community was getting the data as prompt as possible. And so when we realized that we could do that, we went ahead and made those changes. You have to take into account the state is dealing with data from counties, from 99 counties, and so it's not just Blackhawk that they're focused on. And so we wanted to put our energy on focusing on Blackhawk County and ensuring that we have the data as prompt as we can, as fast as we can give to the community.
For someone in the community, what would you say in terms of them for trying to interpret that data if they're looking at both the county's website and the state's website? Should they be kind of open-minded like you were suggesting, or should they kind of focus on one rather than the other, since the county is focused only on Blackhawk and doesn't have as much responsibility as the state does?
So I think if the main focus is on Blackhawk County, I think what I would communicate to the residents is to focus on the numbers provided here at the local level.
Thank you.
If there are no further questions, Dr. Nafissa asked me to also share with you. Last week we hosted, through the EOC and the Department of Health, we hosted a listening post and a forum with our long-term care facilities to find out what kinds of issues we could help them with. We also talked a little bit about forecasting for recovery and things of that nature. We're going to do the same thing this week on Wednesday morning with the partnership that we have with Grow Cedar Valley. We're hosting a business forum, and we've asked several businesses within the Cedar Valley to join us with that. Anybody that's interested in that, please reach out to Grow Cedar Valley to participate with us, because we would love to hear from you and participate with you. That's at 10 a.m. in the morning. We're going to talk recovery, we're going to talk about resourcing, and we're going to talk about partnerships that morning. If there are no other questions, we will look forward to speaking with you again on Thursday at our normal time for a 3:30 press briefing again. Thank you so much for your time and attendance. Have a great day.